It was very difficult some years to be helped by NHIF if you are a renal patient. If you are a patient with kidney issues, it was very difficult to be sorted out by NHIF. One, they forced you to be admitted to be given dialysis. So they loaded the beds in the hospital. Then you could go in the morning and get dialysis, but they say, we'll treat you as an inpatient. That means sleeping in the hospital. And even after sleeping in the hospital, they say we are not able to clear the entire bill. We'll pay 5,000 shillings, 3,000 on top of that, you have to pay yourself. People used to come with consumables, 5 liters of liquid to be used in the machine. And after you have been dialyzed, you go back with your 5-liter container. That's what reminds you are coming from dialysis. Hospital lobbied NHIF for so long. NHIF later on accepted to do dialysis without necessarily forcing you to sleep in the hospital. But they say we are not going to do the kidney transplant. It's very expensive. We said, what we do then? This is a person who we have engaged, we have convinced him to be a member of NHIF. Where can you go elsewhere? Where can you go again to get other money? After we had done several kidney transplants all over, unlike before, and the prices went down in public institutions, NHIF now agreed that they are able to do they are going to support the kidney transplant, which was very good. In the private hospital, in the public hospital, kidney transplant is done and NHIF pays. Now the biggest issue now, Your Excellency, is NHIF does not pay for your medication, which is lifetime. Although your kidney was, found to be compatible with the other one, blah, 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 the body still continuously rejects the kidney as a foreign body. So you need to take drugs every now and then. And you know how much it is, that, Your Excellency? 40,000 shillings every month. So you need to have about 500,000 to have those drugs for 1 year, for example. Now, because you are not able to foot that bill of 40,000 every month of drugs, what happens again? You relapse. You go back again for dialysis because NHIF pays. It will not refuse because it's covered. And the idea of getting kidney transplant was to get out of this dialysis, isn't it? Now, because you are going back again to dialysis, dialysis is a stopgap because you are supposed to go for another kidney transplant, which NHIF is willing to pay for you again. You finish, you replace the other kidney, you are given another one, but you are not paid for the drugs again. So we are finding these people again in the hospital, Your Excellency. It is a very sad story indeed. And that is one aspect of it. Thank you very much.
Thank you very much, Tony. I quite sympathize with especially the last episode you have mentioned. And I think reason should finally prevail the way it has before. I think it's possible to change the mind of people when they get to understand the kind of strain that you're going through. I confirm, because I have been to MTRH myself, that you sometimes find 2-3 people on the same bed and possibly another 2-3 on the floor. And it's not quite it's quite a sight many of us cannot take. But I want to ask about your experience. We tried working with counties to create facilities that are almost at the level of a referral hospital in many more hospitals around the country. Like, for example, we did, I think, 60 hospitals with ICU facility. We did other hospitals with radiology facilities. We did other hospitals with renal